Ladies and gentlemen, good morning, and welcome to our COVID Beat RAC Hospital COVID Rehab, Post-COVID Rehab webinar series. Now, this is our 6th webinar. Earlier webinars covered topics such as the brain and emotions, in which we had a neurologist and a psychologist debating the issues. We then moved on to gastroenterology, where we had a gastroenterologist and a nutritionist. We had a respiratory dysfunction, where we had pulmonologists from India and yoga therapists who taught us breathing techniques. And then we had fatigue, internal medicine specialist and psychologist. And right now we have our 6th webinar. And this is post-COVID musculo-skeletal discomfort and management, in which we have our orthopedic surgeon and head of department in RAC hospitals, and also our physiotherapist and head of department of rehabilitation and physiotherapy in RAC hospitals participating. Now, between 14 and 40% of long haulers suffer from pain, stiffness, muscle weakness, especially around the neck and back area. And this results in reduced strength, stamina, flexibility, and most importantly, quality of life. The good news is, and this is what I'm sure our speakers will emphasize, is that 90% of long haulers improve over a short period of time, up to a duration of 3 and 6 months, and they improve in mobility, strength, flexibility through rehabilitation, lifestyle exercises, yoga, tai chi, and so on. But that's not for me to tell. That is for our valuable and esteemed speakers. Our first speaker, who will talk about the musculoskeletal syndrome, is an eminent and experienced orthopedic surgeon, Dr. John Bera. Now, Dr. John graduated in medicine and then went on to complete his master's, his MS in orthopedic surgery, from the prestigious AIIMS University, AIIMS Hospital in New Delhi. He was also an assistant professor in orthopedics and taught in emergency medicine at AIIMS. Dr. John is currently working as the head of department in our own RAC hospital. His expertise is vast and specific, which includes joint replacement, revision for the hip, knee, and shoulder joints, arthroscopic surgeries of the knee and shoulder, and also deals with pediatric orthopedic surgeries in children. He is also a learned professor and has published over 20 scientific publications and written several chapters in various books on emergency medicine. Ladies and gentlemen, I present to you our head of department, orthopedics, Dr. John Bera.
Good morning. Hope I'm audible to everybody. Well, I thank RAC Hospital and the Arabian Wellness and Management Group for giving me this opportunity to speak on this and the budding topic of musculoskeletal discomfort in post-COVID patients. Can you have the first slide, please? Well, severe acute respiratory syndrome, coronavirus 19 infection, which is popularly known as COVID-19, is almost a household name by now because the entire world has come under its grip. Now, as the virus mutates, so every now and often we get various new symptoms, and this time we'll be talking about the involvement of the musculoskeletal systems, which is emerging, and many patients are getting affected. So we'll divide our group just to see who are the patients get affected, when do they get the infection, or when the joints become infected, how to diagnose it, its treatment, the various prognostic factor, and how to prevent it. Now, as you know, once somebody gets positive with COVID-19, it can be in 4 ways it can get affected. One is asymptomatic. Patients get RT-PCR positive, but there is no symptom, only positive. Patients do not have any fever or anything. So we just treat them in home isolation. And once they become positive, they can mingle in the society. Next comes the mild symptomatic patients who are again RT-PCR positive, but they have little malaise, little fever or sore throat, who do not require any hospitalization, but home isolations with symptomatic treatment, and they come out of it completely. These last 2 groups of patients were moderate and severe. Moderate are patients who are symptomatic with positive COVID-19, and they have little bit of breathing problem. Dyspnea, maybe on the saturation level doesn't come down very often. They hospitalization for surveillance. But the last group, which are severe, who are with a compromised breathing, who are critically ill and need hospitalization or ventilation on ICU care. Next slide, please. Well, now coming over, as the disease advances, or we are coming a subset of people who recovered from the COVID-19 will go on to experience a variety of symptoms, lingering for quite a long time, even after they become negative for the disease. Those group of people are called COVID long haulers. They are called the COVID long haulers who are going to develop the symptoms even after becoming negative after quite a few weeks. And what symptoms they get, that, I mean, those battery of symptoms are called post-COVID syndromes. They can be in the form of extreme fatigue, debilitating headaches, difficulty in breathing, joint pains, chest pain, brain fog, sleep disorders, or loss of taste and smell. Who gets all those things is not yet known, but recent studies, some studies show about 10% people can get this post-COVID syndrome, and some studies can say even 70% people can get it. Some studies show people who are above the age of 50 years and were critically ill, they develop all this. But some publications show even at the age of 30, 35, 40, 50 also people are getting out. Patients are getting after getting recovery from COVID. So now we'll restrict our topic to the joint pain only. Next slide, please. Yeah. So as the disease seizes out, say maybe after 9 or 10 days or 14 days, the patients become negative. But the COVID-19 is a viral infection, as all of us know. So it hampers the body's immune system in such a way that the autoimmune response comes into play and keeps on continuing for weeks after a patient becoming negative. So what are the musculoskeletal disorders the patients normally manifest? Usually it starts after 2 to 3 weeks in the form of pain and swelling in the joints. Then which joints are affected? Usually the joints in the hand, small joints, that is metacarpophalangeal joints, and interphalangeal joints in the hand, that may be proximal interphalangeal joints or distal interphalangeal joints. Similarly, in the foot, it can be metatarsophalangeal joints or interphalangeal joints. as shown in the figure. You can see there is a swelling here in the great toe and the second toe. Here also great toe and second toe, there is swelling as well as discoloration, purplish or pinkish discoloration. Even there are incidences of bilateral ankle joint involvement in the form of, again, pain and swelling. There are few cases in which the long joints, that is the knee joints, has been involved in some patients in the form of, again, this is the normal knee joint and this is the affected knee joint, where you can find there is mild swelling, and that is after the post-COVID infection stage. So when does this patient suffer from this post-COVID joint pain? Usually after 2 to 3 weeks of patients becoming negative or coming out of all the symptoms and the test becoming negative, they complain of this pain, swelling in the joint. That is called a reactive arthritis or autoimmune inflammatory arthritis of the joints. So how do the patients present? They present with pain and inflammation and color changes. Pain can be moderate to severe at times. So any patient coming to with these symptoms, what we normally do, because since this reactive arthritis can happen in very many conditions, like viral diseases like chikungunya and dengue fever, or pain, especially in the foot over here, it can be due to a gouty arthritis or rheumatoid arthritis, or some gastrointestinal disorders, or some sexually transmitted disease. One has to rule out each and everything. First, we do a complete blood count, ESR, C-reactive protein, uric acid, rheumatoid factors, and those are usually negative. Then you do a plain X-ray of the affected joints. X-rays are very often negative because these are extra-articular manifestations. That means the joint is not damaged. On the finger and the foot, we can do an ultrasound which shows synovial involvement. That could be synovitis type 1 or type 2. And the knee joints, MRI can be done. MRI shows mild effusion in the patellofemoral space with soft tissue swelling and subcutaneous edema in the myofascial plane. So once we diagnose this, after getting negative result for the viral diseases, for sexually transmitted diseases, for gouty arthritis or rheumatoid arthritis, then comes the treatment part. But it has also been noticed that patients who are rheumatoid arthritis positive or pre-existing arthritic conditions, few of them in the post-COVID stage, there is a flare-up of the symptoms. I remember there was a published article, one lady who was rheumatoid arthritis, and she was silent for 2 years. There was absolutely nothing. But in the post-COVID stage, she came out with a flare-up of the symptoms. And once these patients are diagnosed, it is a post-COVID reactive arthritis. After doing all the tests, starts the treatment. First is assurance of the patients. So we give non-steroidal anti-inflammatory medicines, that is in the form of celecoxib, etocoxib, COX-2 inhibitors, and the patients usually respond well over a few weeks' time. In certain cases like knee and ankle, if the pain persists, we can give intra-articular injections of glucocorticoids. And similarly, in the hand and foot, if the pain and swelling still persists in spite of the non-steroidal anti-inflammatory drugs, we can still give them oral steroid for a short course, maybe about 10 to 15 days. And the patients are usually treatable and they come out of the problem very nicely and completely without any sequelae. And as I said, this post-COVID reactive arthritis is an extra-articular things. Usually joints are spared. But I would suggest one more thing, as new complaints and various manifestations are coming. As all of us know, this COVID-19 causes thrombosis of the blood vessels, which leads to ischemia. Initially, it was restricted to lungs. Now, lots and lots of gastrointestinal surgeons, they found ischemia of the mesentery also because it causes thrombosis of the mesenteric arteries. So we do not know, since there is lots of mutation taking place. So in the post-COVID stage, if any patients develop hip pain, I would rather say, then they should immediately meet the orthopedic surgeons, because one condition, which is a avascular necrosis of the femoral head, which can arise due to ischemia of the blood supply to the femoral head, which diagnosed early can be treated early, or else if it is neglected, can lead to joint damage and later on major surgeries. Can you have the next slide, please? Treatment, already I have said, which treats with non-steroidal anti-inflammatory drugs, in certain cases in the major joints, intra-articular steroids, and an oral short course of steroid, and the patients normally come out nicely of it. Next. In conclusion, as I said, it is a reactive arthritis or an autoimmune inflammatory arthritis in a response as the autoimmune systems is attacked by this COVID-19. So in the post-infective stage, when the patients become negative, usually after 2 to 3 weeks, I'm not talking about myalgia, but the joint pains with inflammation. So the patient presents with pain, synovitis, mild diffusion, but without any damage to the joints. So far, so we have seen it involves the small joints in the hand and the foot, but ankle joints and knee joints involvement is also there, though it's not as frequent as smaller joints. And these conditions are completely treatable and reversible. Next, can you have the next slide, please? So now the take-home message is the best way to limit or inhibit the spread of infection of COVID-19 so that one doesn't get the COVID-19. So once you don't get the COVID-19, you don't get the post-COVID syndrome or this joint pains or this any form of post-COVID syndrome manifestations. So what is there? That is SWAP. That is most important is social distancing. Next is wearing the proper mask properly, meaning thereby one must use a 3-layered mask and the nose and the mouth should be covered snugly. And the A stands for avoiding crowd or mingling with a large gathering. And finally, practicing excellent hand hygiene and limiting the touching to the nose and the face. So this is in short about the various manifestations which occurs in post-COVID stage and the joint pains and its treatment and how to prevent it. Thank you very much for listening.
The thumbs up was for you, Dr. Jainbera. Thank you so much for your presentation. Thank you so much. We've learned a lot from your presentation, and with the problems that you present, we would now pass this on to our head of physiotherapy. That would be our own Miss Cornelia Glue to help us with solutions. Now, Connie, as we refer to Cornelia, has graduated in physiotherapy from the Bern University. And that would be, well, she has spent enough time, the Bern University of Applied Sciences in Switzerland. Now, Connie has a specialization and is an expert in the rehabilitatory process for knee replacement surgery. Can we have Connie on full screen, please? Okay, that's good. Connie is an expert on rehabilitation processes for knee replacement surgery and also works with neurological and pediatric cases. We hand over to Connie.
Hi, good morning to everyone, and thanks for having me here. It's my pleasure. Thanks to Dr. John also for the nice talk we had already this morning. So now I would also like to welcome everyone, and we talk a little bit about the musculoskeletal discomfort and its management. So what I would like to talk about, please go to the next slide. I would like to talk a little bit about symptoms. That means mainly what kind of symptoms we are seeing in the physiotherapy department, the reason for symptoms they are there, and a bit about the exercises and a few health tips that can help you all. So the first symptom, the main symptoms actually what we are seeing. Can we have the next slide? Actually, what we already see is that most of our patients, they suffer from lower back pain. That is one of the most common problem. And now, due to COVID, definitely that has a bit increased. I will come to the reasons why that is a bit later. We also see a lot of neck pain cases, a lot of upper and middle back pain, headache. Then we have a lot of patients with pain in the legs and specific knee pains. Now, I would like to explain why these things are happening and what are exactly the symptoms. Because there are so many different kind of lower back symptoms and lower back problems. But in the moment, what we see a lot is that people have like a dull aching pain in the back, and it's a bit low and it's going down to the legs. And mainly, of course, when people are sitting for a long time and then they stand up, or even they're still sitting, they're getting a lot of pain. And what helps is only like moving. So we can already see that, of course, because of the COVID, a lot of patients or a lot of people are mainly sitting at home. It's either online studying or working from home, working on the computer. So that has increased the lower back symptoms. Now, when you see the next slide, you can see that the pain in the lower back are spreading down. Okay, so patients are complaining about pain in any kind of the regions which you can see are in red. So people have pain all over the place going down to the foot. Sometimes people have no problem in the back itself, but they complain about pain in the foot itself. But it's like a tingling, it's like a numbness, or it's just not comfortable. But all comes from the back, and most of the time, what we see is that the muscles are super tight and they're weak, and that all will give that symptoms. Now, the similar thing is actually happening with the neck. So in the neck, when you see the next slide, there people getting stiff necks. They have difficulties in turning the head. That again, due to sitting in front of the computer or using the mobiles. We will come to that later again also. The pain is more like a sharp pain, and it's like a stabbing kind of pain, and it's mostly like in one spot. Like they will say, yeah, I have pain here, I have pain a little bit in the upper body, upper part of the back. It's also like tender and sore, and a lot of times it radiates down to the arm. People feel like there's a tingling in the arm, there's a numbness, or they even just feel like there's a weakness in the arm. They cannot move proper, or they cannot hold things very well. Now, when you see the picture of the neck, you can see one of the big muscles, which is in red, the trapezius muscle. It's quite a big muscle. And when you see the muscle goes from backside, like from the shoulder, it goes all the way up and is attached in your head. And when you see down, it goes all the way down, almost, it's like in the middle of the back. So that's a really big muscle. muscle and can affect your whole back almost. Mainly because it's tight and there is a stiffness in the muscle. It will pull, and it will pull you even from the head. So the people, that's why people are getting headache also. So imagine you have a very stiff muscle here, you feel there's a tight pulse from up here, and people are feeling headache, all of a stiff neck, or they have actually a muscle problem, but they just complain about the headaches. Sure, headaches are also coming because of the screen again. Looking at the screen makes the eyes tired, and that's why the headaches are coming more often nowadays. But mainly we can see that because of the tightness of the muscle. Now, knee pain is also very common. That is mainly when people they feel like there's a swelling or there's a stiffness in the knee, and they're like not able to completely straightening the leg or bend it. They have a problem or pain when they have to bend. For example, when people have to pray, they are not able to do that. Most of the time, pain is coming when people have to climb stairs, or when they just have to simply bend the knee or sit down. There's also certain times that there's like a clicking sound, or they feel like it's not stable. The knee is not holding. Like when I walk or when I run, I feel like the knee is giving away and I don't have enough power. Now, when you see the next slide, I'd like to talk a little bit about the reasons why all of this is happening. Now, we already see all of these things in a regular daily basis. That's what we see most of the time in the physiotherapy department. But due to COVID, we see especially these symptoms much more. And that all comes from sitting position. Of course, all of us are sitting much longer, much more in front of the computer. We are maybe not going out as much as we used to do, even at work. We have more meetings, everything is online. Teachers are online, kids are online. So even that has changed a lot. And due to that, we even see younger people and kids with all of these issues. Now, another problem is that it's not only about the sitting. The point is usually how you sit, or how long you sit, or when you sit. And that is a bigger issue. Like if it's just sitting, it's okay, your body can manage. But what is the problem with sitting is that we sit for too long at one time. Okay, so when you, for example, I usually tell my patients as well, like if you would ask me to run a marathon, I could not do it. Why? Because I didn't train to run a marathon. Okay, so if you want to do that, you have to do a training, and you would train, you would start with a little bit of running and you would increase it. Now, sitting is one of the heavier things for the back to do. And we are simply asking our back to sit for hours and hours the whole day. But we do not strengthen our back muscles to be able to do so. Same with the neck, of course, and same with our knees. So that is the other big problem, that we are not doing enough workouts. So as you can see, we are not doing enough physical activities. We are not doing specific strengthening exercises for our back to be able to sit and make us, having a proper posture. So that all leads to back pain, neck pain, and especially also upper back pain, as I mentioned already, because the position is getting worse. Then we're sitting like that, or we are sitting in the wrong position in the chair. That's not going to work. Same thing with the mobile phones, of course. We hang on the phones a lot. It's also a common thing that happens nowadays already, but because of
Friends, I apologize for the vagaries of our connectivity. We unfortunately have lost connection with our esteemed speaker. I am sure much to her discomfort, and my apologies for that also. We are now checking to see whether we have connectivity with our other speaker, Dr. John Bera. And since we do, may I request my colleague, Dr. Wilku, to raise a few questions for Dr. John Bera to answer.
Thank you first of all, thank you very much and welcome everyone. Especially thank you to Dr. John Bera for our orthopedic HOD and Ms. Corny, HOD for physiotherapy and rehab. Am I audible? Yeah. So we received a lot of queries regarding this orthopedic problem, health issues. So I'll be taking up a few of them. One question has been asked, does COVID cause joint pains or it only increases the existing joint problem? So Dr. John, you can answer this.
See, there are publications, there are incidents in post-COVID infection states. New cases of joint pain. Yes, post-COVID causes joint pain, as well as if the patients were having any pre-existing joint problems like rheumatoid arthritis or any arthritis. Even there are incidences in post-COVID states, it aggravates the symptoms. So my answer to both is yes. COVID causes joint pain as well as it aggravates also.
So Shoaib has asked, his uncle is 52 years old and he has been diagnosed with osteoarthritis of knee and he has been advised for TKR.
Yes.
So he's asking, is it safe to have TKR surgery during this pandemic?
Yeah, very good question. See, there are various studies. How was his uncle during COVID stay? It was a case of mild, moderate, or severe? If it's a mild case, then after 4 weeks, he can go for surgery. If it's a moderate case, then 6 to 10 weeks. If it was severe, then it is better to do after 14 weeks of post-COVID state for TKR. Yes.
One more question is being asked. What is the general management of keeping the joints healthy? And what are the exercises to prevent musculoskeletal disease?
Well, I think that should be better answered by Corny, but as an orthopedician, I would like to tell you, see, the normal thing is God has given us joints to move. Until and unless there is a contraindication to move, one should keep on moving. That means mobilizing the joint. As you said, osteoarthritis or rheumatoid arthritis. Even if there is a pain, one must keep on moving. What is the best exercise? Depends. What age the patient is, how much his body allows. I mean, you can keep on walking, jogging, static exercise, or strengthening exercise. There are various types of exercises, but no joint pain. If it is not contraindicated by the orthopedic surgeon or the doctor, one must mobilize the joint in any form under the supervision of physiotherapist or the doctor.
Connie, this actually question was for you. What is the best exercise to manage the joints healthy? And second part is, do exercise prevent a musculoskeletal disease? So your point as a physiotherapist.
What was the first thing you said? Question?
What is the general management to keep the joints healthy?
Okay, well, yes, exercise, because the muscles need to be stronger so they can support the joints, right? So exercise and strengthening the muscle and moving is one of the best things you can do for the joints. As I just heard from Dr. John, which I was about to say as well, there are millions of exercises that can be done, and you can see them in YouTube, in social media, wherever. But the most important is you should ask a professional. So in this case, is usually a physical therapist, which can guide you to do the proper exercises, because the main thing is to do the exercises in the correct posture and position. Otherwise, it will lead again to issues and pain.
Yeah, thank you. So I would just add one line to your suggestion. We have a few exercises, the best exercises which can be done in our website, COVID Rehab website. Ms. Corny has being modeled into that exercise. Strength exercise, stamina, and flexibility, all exercises are there. So if you want to see how to do that particular exercise, you can visit our website, COVID Rehab, and there you will find in the video section Ms. Corny's videos are also being posted over there. So my next question is from Mr. Bharat. So he is saying I am 32-year-old and I had COVID last year. Now I developed pains in multiple joints. I have a family history of gout. So what should I do? Dr. John, you can answer better for this. Doc, you have to unmute yourself.
I'm doing it, yeah.
Yeah, sure.
See, any symptom developing after 1 year or more, I mean, it's not a sequelae of COVID. It's a new thing. So if there is a family history of gout, I think the patient should go to an orthopedic surgeon or a general medical practitioner, get his blood and tested, especially we test for the uric acid and the X-ray of the joint. And if it is found the uric acids are high, hyperuricemia, then there are various medicines in acute inflammatory stage when the joints are inflamed and it's too much of pain, followed by different medicines which patient has to take for a little longer time, along with some dietary restrictions and exercises.
Okay, thank you. One more question is from Harsahej. He is asking, my father had mild arthritis in left knee. Now he is being recovered from COVID, but he still feels the pain and stiffness, which has increased. So there are two connective questions to it. Do he need to increase the painkillers, which I think Dr. John can answer better, and Corny can answer what exercise he should be doing to regularly manage the stiffness of that joint.
See, as I told in my lecture also, patients who have pre-existing arthritic conditions, it has been seen in post-COVID stage, it may aggravate the symptoms. So if his father had arthritis previously, now it has increased, then the first thing is he should meet the doctor and get it checked whether there is an acute inflammation on a chronic disease, which can be again seen by doing some blood tests and ultrasound or MRI depending on the joint. Because if there is an increase in the pain, the patient should not try himself to increase the dose of the painkillers. Let the doctor see it, because in acute inflammatory state, if required, they can add some local, corticosteroids either orally or intraarticularly, along with some non-steroidal anti-inflammatory medicines. And if he's taking a non-steroidal anti-inflammatory drugs, which is not taking care of the pain, then he can switch over to other things. So these are the various possibilities. So they should meet the doctor, not self-medicate. And regarding them, and one more thing, I was telling you, somebody had asked for total knee replacement, as I said, mild, moderate, severe, weeks wise. Yeah. But since total knee replacement is a major surgery, so in my opinion, they should go for the surgery at least after 10 to 14, better 14 weeks, because there is clear-cut guidelines, 102 days after. So that comes to 14 weeks, since it's a major surgery. Now Corny can take over what are the exercises to be done.
Yeah, the question was, one of the client, his father had a mild arthritis in the left knee, and he had COVID, but he has recovered. So what exercise he should be doing in regular pattern to manage the stiffness?
Well, see, this is exactly one of these cases. Now, the question is, has the patient seen a doctor already? And if the situation has changed, then definitely you should go first to see a doctor, and the doctor will guide the patient to go to the physiotherapy so that the exercises can be shown. We don't know much about the patient, like what is the age, what is the status, is he walking, is he not walking? So I cannot just simply say do this and this, because that would be wrong. So same with what Dr. John already said, should consult the doctor first and the physiotherapist to make sure he has the proper exercises and he can do it in the right way. Otherwise, it is going to make it worse. It's better to consult someone that can guide him in the proper. Yeah, that would be the best to do.
Yeah, thank you, Connie. There is one more question. Does COVID infection causes joint inflammation like bursitis or tendonitis? There was one more question, which I think that will be the acute query for an acute inflammation. What is the management for a tendon rupture? Doc, I think you can.
See, tendon rupture doesn't happen with COVID. Tendon rupture is entirely a different.
That's what I said. That's why I said that's a completely acute problem. Some client is asking.
See, tendon rupture can happen either with trauma or without trauma. For instance, if you're having a chronic inflammation or micro trauma to that tendon for quite a long time, and many a times, like you have a tendon achialis or a patellar tendon inflammation, and you are treating with somebody has given a steroid. I mean, the tendon is already weak. If it tears, then the treatment can be very. I mean, which tendon he is talking of? I do not know which tendon. If it is tendon achialis, there are so many papers, publications. In acute injuries, it can be treated conservatively as well as surgically. So that again, we have to do MRI, see the patient, what age, what are the comorbid conditions. And so, I mean, there is not a single black and white answer. If this is the treatment. It depends where is the tear and what is the gap between the two tears, how much is the retraction of the tendon, how old is the tear. So all those things are the factors which makes the surgeon to decide, and with the discussion of the patient, because even without surgery, it takes about 2 months to be on a conservative treatment. Even with surgery also, that takes about that much of time. So, and coming over to your bursitis and tendinitis, the COVID doesn't cause all these things, but there can be flare up of the things, as I told you, because of the inflammation, ongoing inflammation in the body.
Yeah. Thank you, sir. There is one more question. I think this is the last question. My wife had cervical spondylitis. What exercise is suggested to do, and what are to be avoided? I think both of you can answer this. Cervical spondylitis, and what are the exercises to be done, and what are the exercises to be avoided?
See,
Corny can say what exercise to be done. I would say what not to be done is don't do any sirsasana, don't do any sirsasana if you are doing yoga and all those things. Okay. Don't carry any heavy weight on your shoulder, on the head. These are the few things you should avoid, and don't sit in a very bad posture. That will aggravate your conditions, and Corny will tell you what exercise to be done.
Yeah, Corny, please.
Yeah, that's absolutely right. I would have said the same. Again, the same thing. Please make sure you go somewhere where people can show you the proper exercises. Again, you can go and Google exercises for the neck, but the main, especially with the neck, it's very important to have the proper position. Now, how would you do the exercise if you don't know what is the right position? So make sure you go to a physiotherapist that can show you the exact position that has to be done with the neck, and then the exercise has to be done in exactly that way. Otherwise, it's going to make it completely worse. Of course, we can say, okay, you can move your neck, you should do a bit of stretching, but again, it's a condition which is mentioned, but what exactly are the symptoms? So the people with this kind of condition, they might have a pain in the neck itself, but another person can have a pain in the neck itself or in the upper back. So what exactly are the symptoms that are there with that patient, with that specific case? We don't know. So that's why make sure you go and see a physiotherapist, which can exactly tell you which exercises are there to be done, please. That would be always the best thing to do. Don't just do something and then it is wrong. That will always make it worse.
Yeah, definitely. That was a very good answer. You should always consult your physiotherapist or orthopedic before going to do any exercise. You should have a medical clearance. Don't follow YouTube and other exercise patterns which are you can get easily in the internet. There is one more question, one good question. A lady 50 years old, she had COVID. Now she experiences left calf muscles, which she says is developed after the COVID. Is it anything to be concerned about with a clot in the lower extremity or the muscle weakness? Doc, I think you can answer better for this.
Yeah, yes. See, it could be a simple fatigue or myalgia, But specifically, since he says there is a pain in the calf muscles, and if the pain is, I mean, the thrombotic pain are quite excruciating.
Yeah.
I mean, if you palpate the calf, if you touch the calf, if it is painful, I mean, if you dorsiflex your ankle, if it is painful, then it is something very serious. Then one must meet a doctor, do a Doppler ultrasound to find out any thrombosis of the vein, and a blood test, especially the D-dimer study, and your CBC and CRP, just to look out for any inflammation is there or not. Yes, calf pain, if it is persisting, and as I told you, there is tenderness in the calf, and on stretching of the ankle that is painful, then one must consult an orthopedic surgeon.
That's a wonderful answer, sir. I think this was the last question. So Professor Kennedy, you can take over.
Thank you. And a special thank you to our esteemed speakers. I'd like to thank our HOD Orthopedics, Dr. John Bera, for his enlightening inputs. I'd like to thank HOD Physiotherapy, Miss Cornelia Glur, for her absolutely supportive advice to our colleagues who may have had musculo-skeletal discomfort as a consequence of COVID. I'd like to thank our valuable participants for sitting through this program, and also apologize for some of the connectivity issues that cropped up, which unfortunately was a little beyond our control, but my apologies nevertheless. Now, for long haulers to get the full benefit of this series of programs beyond the bi-weekly webinars that we conduct, we also have an exciting website. In case, will you be uploading the website, Mr. Srikanth? In case you do log on to our website, then you would be able to check in on the post-COVID rehab scan. Now, this scan will ask you for your symptoms and ask you for your comorbidities, and then give you an extensive prescription which has been created by an arsenal of doctors to cover the entire spectrum of possibilities. Now, you will also be able to click on the weekly health tips. There are hundreds of health tips that you will get, which will give you advice on different aspects of post-COVID situations. And all our webinars are recorded. So you will actually be able to go back and have a look at every webinar that we have conducted. And as you know, we have conducted 6. And if I look at my notes, I know that we've done something on the brain and emotions. We've done something on gastrointestinal discomfort as a consequence of COVID. We've done something on respiratory dysfunction. We had an outstanding pulmonologist from a different country speaking. We also had our own international speaker on internal medicine when we spoke about fatigue. So we've had several, and this, of course, is our 6th session, which will be recorded and put onto our portal for you to see. And in addition, of course, kindly keep in touch with us, and we will be uploading the next webinar. Now, our next webinar will be dealing with diabetes. So, ladies and gentlemen, friends, colleagues, thank you so much for listening into this program, and I look forward to seeing you again in 2 weeks' time, where we talk about the diabetic management for post-COVID clients. Thank you so much, and have a great day.